section is on sleep disorders for behavioral science and psychiatry for Falcon Physician Reviews. So normal sleep is divided into two different phases. You have your REM sleep and your non-REM sleep. And what does REM mean? It means rapid eye movements. So if they ask you a question about that, instead of saying REM, they say rapid eye movements. It's the exact same thing. So in non-REM, you have stages of 0 to 4, and then REM does not have any stages. So when you're awake, there are two different types of waves that are found on the EEG. You have your beta waves, which show active mental concentration, and then you have your alpha waves that show relaxation with your eyes closed. And they can ask you this question on your USMLE. They might give you a vignette of a person that's just relaxing in a chair and asking you what the predominant sleep wave will be. Now, in your non-REM, which is your stages 1 through 4, these are very high yield points. And what they'll do is they will give you the vignette of a person who's sleeping, and they'll say, well, you will see these kinds of waves, what stage are they in? Or they will give you someone who has a parasomnia and ask you what stage it occurs in. So stages of sleep will be very important for you. So stage 1 is the lightest stage of sleep. Generally, you will see theta waves, and you'll have a slowed pulse, respiration, your blood pressure will go down, and this only constitutes about 5% of your sleep time. Not a very important stage of sleep out of the 4. But stage 2, actually, you spend about 45% of your sleeping time in stage 2. So this is where you spend a majority of your time sleeping. And the most important points about stage 2 is that you will see sleep spindles and K complexes. I would remember that for your exam, because that will help you identify that they're talking about stage 2 sleep. Next, you can actually group stage 3 and 4 together. Now, this is considered deep sleep. And in deep sleep, you have delta waves. So both of those are D's, deep and delta. And this is slow wave sleep. It's very deep. You're very relaxed. And this is frequently where a majority of your parasomnias occur, such as night terrors, somnambulism, which is sleepwalking, and enuresis. And stage 3 and 4 constitute about 25% of your sleep time. Now, stage 4 is where the human chorionic gonadotropin, or the HCG, is also released. In non-REM sleep, your mind is asleep, but your body is awake. Also, your autonomic functions are decreased, and your growth hormone is also secreted in your non-REM sleep. So how will you remember your non-REM sleep? Your body is moving, but your mind is asleep. Now, REM sleep will be the exact opposite. Your mind is awake, but your body is paralyzed. And you will also have an increase in your autonomic function. So your pulse will be increased, your respirations will be increased, and your blood pressure will also be increased. You'll be dreaming during this time. So frequently, when people come and wake you up, or your alarm clock comes and wakes you up, you'll notice that you're dreaming and you're coming out of a dream. Well, that's because you're in REM sleep. And as you sleep, your REM periods increase progressively throughout the night. So towards the end of your sleep, you actually have more REM sleep. Now, it takes about 90 minutes to get into your first REM episode, which means that from the time you've fallen asleep to the time you've gotten to REM, it's about a 90-minute time, and that's called REM latency, and that's normal. And later on, we'll discuss times where you'll have a decreased REM latency or an increased REM latency. Also, I did mention that your brain is awake and your body is paralyzed. But in REM sleep, you will notice the penile and clitoral erections. And you know how they say men have two brains? Well, so if you can remember it that way, then you can remember that your mind is awake. That's when you have your erections, because those are the two brains of the men, and your body is asleep. Characteristically, they have very sawtooth beta, alpha, and theta waves, and these are very, very small frequent waves. And this constitutes about 25% of your sleep time. So what is sleep latency? Sleep latency is the time that it takes for you when your head hits the pillow to when you fall asleep. So from when your head hits the pillow to when you enter your first stage of non-REM sleep. Generally, this should take less than 30 minutes for people to fall asleep. And for most people, it takes about 10 to 15 minutes. Now, your REM latency is the time from when you fall asleep to when you enter into your first REM period. Generally, it takes about 90 minutes, can take up to 120 minutes. And these non-REM REM cycles repeat themselves repeatedly every 90 minutes or so. and you have about 4 or 5 REM cycles per night, and they become more longer and frequent as the night progresses. So what are the different neurotransmitters of sleep? Both serotonin and acetylcholine promote sleep, whereas norepinephrine and dopamine promote wakefulness. Now, serotonin, that makes sense. So people who are depressed frequently have a hard time falling asleep. So when you give them a serotonin reuptake inhibitor, which increases their serotonin in their synaptic cleft, their sleep is one of the first things that improve. So that makes a lot of sense. As well as acetylcholine. When people get older or when they have Alzheimer's dementia, they have less acetylcholine, they don't sleep very well. I don't know if you've noticed your grandmother and grandfather, they don't sleep as long. They see you, they fall asleep, and then they wake up really early. They don't need as much sleep as we do. Well, that explains why acetylcholine decreases sleep if you don't have enough. And norepinephrine and dopamine are kind of stimulant kind of neurotransmitters, so it explains why they would promote wakefulness. So where do you get increased sleep latency? So that means where there's increased time for you to fall asleep. Adolescence is one. Poor sleep hygiene, for example, if you've taken a nap in the afternoon or you just drank a Coke before you went to sleep. Depression, anxiety, mania, these are all reasons why it's hard for people to fall asleep. Now, where do you get a shortened sleep latency? Adulthood and elderly. Elderly usually fall asleep pretty quickly. You know, they're talking to you and they're out, but they don't sleep as long as we do. Alcohol and drug-induced sleep, narcolepsy, sleep apnea, and sleep deprivation. So there's different types of sleep disorders. You have dysomnias, which are problems in timing, quality, and the amount of sleep. And then you have parasomnias, which are abnormalities in the physiology or behavior associated with sleep. So the different kinds of dysomnias we're going to talk about are narcolepsy, sleep apnea, insomnia, hypersomnia, and circadian rhythm sleep disorder. And parasomnias include sleepwalking, sleep terror, and nightmare disorders. So what is narcolepsy? This is excessive daytime sleepiness with changes in your REM period. So what these patients will do is that they'll be in class or at work, and all of a sudden they'll just fall asleep and they will immediately enter into the REM period, which is actually not normal because from what we learned before, you generally go through a stage of non-REM and then you go into a REM stage. So what these patients do is that they immediately go into a REM phase. Now, the clinical presentation of a patient with narcolepsy is cataplexy, and what cataplexy means is that suddenly these patients will get a heightened sense of emotion, such as they'll laugh, they'll cry, all of a sudden they'll lose all muscle control and they'll fall to the floor. And then eventually they'll get back up. Another symptom is sleep attacks, where these patients will suddenly just fall asleep. They can fall asleep when they're driving, when they're in a lecture. Sleep paralysis. This is when patients will be awake, their mind will be awake, but they feel like they can't move their body. And hypnagogic and hypnopompic hallucinations. Now, these are the only types of normal hallucinations. And what hypnagogic hallucinations are when you're going to sleep. And how are you going to remember that? Hypnagogic has a G, and when you're going has a G to sleep. Well, that's a way to remember hypnagogic. And hypnopompic is when you're waking up from sleep. So how will you treat someone who has narcolepsy? Want to establish a very strict sleeping schedule with frequent scheduled naps if possible. And also you can use some medications. Now, tricyclics such as imipramine can be helpful with the cataplexy, and also psychostimulants and modafinil are helpful with narcolepsy in general. Next we have sleep apnea. And how they tell you sleep apnea on the exam, it's going to be very easy for you to identify. It's generally going to be an overweight, obese man who comes in with his wife, and his wife is just complaining. My husband doesn't let me sleep, he's up all night snoring, I've had to move out of the bedroom, please doc, do something about this. Okay, so that's what your vignette's going to look like on your exam. But what is sleep apnea? It's a periodic episode of apnea during sleep. And it can be either due to a central reason, such as in your brain, or it can be due to a peripheral reason, such as obesity, maybe you have an adenoid problem, a tonsil problem. Now, this doesn't just occur in an older man. It can occur in children, it can occur in women, but commonly does present in an older, obese man. Patients frequently awake unrefreshed, they're sleepy a lot during the day, they have high blood pressure, dry mouth, and depression. Now, this can be pretty severe on your body. They can experience blood oxygen desaturation, cardiac arrhythmias, pulmonary and systemic hypertension, morning headaches, confusion, depression. So this is a pretty severe illness that's easily treated and should be recognized and treated immediately. So you have obstructive sleep apnea,